Chapter 4, ADHD in Children, Symptoms and Diagnosis. Recognizing ADHD in children. In order to get a diagnosis of ADHD, a child must have exhibited symptoms for at least 6 months, and to an extent that is unusual for their age. It is important to recognize that many children display symptoms of ADHD without having the condition, purely because children do have shorter attention spans and are generally more active than adults. In each of the primary categories, at least 6 of the following symptoms are likely to be apparent. Inattentiveness and attention difficulties. Easily distracted by outside influences such as noise, others' activities. Frequently forgetful in everyday activities. This can include items or information. Disorganized in activities or necessary tasks. Difficulties in paying attention to details and making careless mistakes. Difficulty sustaining attention in work or play. Avoidance of activities that require sustained mental effort, such as homework. Has trouble following through instructions or to finish homework or chores, not because of deliberate disobedience or failure to understand. Appears not to be listening when addressed directly. Often loses things like pencils, books, or toys. Impulsiveness. Interrupts and intrudes on others by butting into their games or conversations. Has difficulties waiting in lines or waiting for their turn in games or group situations. Blurts out answers before the question has been completed. Hyperactivity, restlessness. Runs around excessively, climbs things. Excessively noisy when playing, has difficulty with quieter leisure activities such as reading or jigsaw puzzles. Fidgets and squirms a lot, hands and feet are often moving. Often leaves seat inappropriately, for example in the classroom. Talks excessively. Always on the go, seems to be driven by a motor. Other difficulties that occur in children with ADHD. A number of behavioral problems can occur alongside ADHD. Some of them, but not all, occur because of the child's frustration and difficulty in understanding and managing their condition. These can include conduct disorder. The child may be destructive or display deceitful behavior such as lying, stealing, or rule breaking. This is estimated to occur in around 25% of children. Oppositional defiance disorder. The child has disruptive and oppositional behavior that is usually directed toward authority figures such as parents and teachers. Confrontational defiant behavior. Estimated to occur in around 60% of children. The child may argue, lose their temper, and refuse to comply with adults or deliberately annoy others. Depression. This can range from moderate to severe, with an estimated 33% of children suffering with severe clinical depression. Anxiety disorders. These occur in around 33% of children with ADHD. Specific learning difficulties. Unrelated to ADHD, but occurring in 25 to 30% of children with the condition. Diagnosing children with ADHD. Children with ADHD can go on to lead successful lives once the condition has been diagnosed. The earlier the diagnosis, the better, because the child can then access the best treatment for them in order to manage their symptoms. Left untreated, ADHD may lead to more serious problems, including failure at school, depression, relationship problems, job failure, and substance abuse. It is also essential that at first any other cause for the symptoms is ruled out. Who diagnoses ADHD? A diagnosis of ADHD requires an assessment conducted by a qualified, licensed healthcare professional, usually a developmental pediatrician, child psychologist, child psychiatrist, or pediatric neurologist, who has a thorough understanding of ADHD and other similar conditions. Your primary care physician may be able to make the diagnosis or refer you to another clinician with experience of diagnosing ADHD. Only certain medical professionals, however, can prescribe medication for ADHD. The evaluation. A diagnosis of ADHD is made on the basis of observable behavior in at least 2 settings, such as the home and school. The healthcare practitioner is likely to carry out the following: a thorough medical history of the child, a medical history of the family, interviews with important adults in the child's life like the parents and teachers, behavior rating assessments with parents, teachers, Observation of the child. Psychological tests of the child assessing IQ, social and emotional adjustment. Assessments for other specific learning disabilities. After evaluation. To confirm a diagnosis of ADHD, the healthcare professional will measure their findings with the DSM-IV, Diagnostic and Statistical Manual of Mental Disorders, 4th edition. An important criterion for diagnosis is that the symptoms have been present in the child from before the age of 7. The symptoms must also cause significant problems in the child's social and academic life and be inappropriate for their age. Confirming the symptoms. The healthcare professional must then be certain that the symptoms are not being caused by a different disorder, such as anxiety disorder, personality disorder, or a personality change due to general medical disorder. In these disorders, the symptoms of inattention typically appear after the age of 7, and the child's history is not characterized by disruptive behavior or observations of inattentive, hyperactive, or impulsive behavior. Social factors. In addition to this, certain social factors such as divorce, child abuse, death of a loved one, or environmental disruption such as change in residence or school may result in temporary symptoms of inattention, impulsivity, and hyperactivity. In these circumstances, symptoms usually arise suddenly and would therefore have no long-term history. Of course, children with ADHD experience these situations, so they alone would not rule out a diagnosis of ADHD, but be considered as a part of the whole. Coexisting conditions. ADHD can and often does exist with other difficulties, particularly learning disabilities, oppositional defiant disorder, and conduct disorder. The whole picture needs to be examined to make sure the child and family get the help and support needed. Summary. Diagnosis is not a simple process. There is no test that can confirm ADHD. However, the more parents can understand about the process, the more sure they can be that their child has been given the correct diagnosis and is accessing the best possible support for their needs.